Greetings everyone. I want to welcome you to another episode of Faforlife Health Talk series. Today we are going to be looking at a very major health concern in our society. It is called diabetes mellitus. Let's talk about diabetes. What is diabetes mellitus? Diabetes mellitus is a chronic metabolic disorder affecting the way our bodies make use of carbohydrates. There are two major processes that have been identified to connect with diabetes mellitus. The first is the inability of the body to make enough insulin, and the second is the insensitivity or resistance to the insulin being produced by the body. Insulin is a hormone produced by a small organ within our abdomen called pancreas, and the pancreas makes the hormone insulin in response to blood sugar increase. So when you finish eating any meal, the blood sugar rises. As the blood sugar rises, the pancreas will respond by producing a hormone called insulin. Now, the work of insulin is to lower the blood sugar and bring it within a range, what we call glucose homeostasis. It continues to ensure that at all times, the level of the blood sugar in our system is maintained within a particular range, whether you eat or you do not eat. That is what we call glucose homeostasis. Insulin is responsible for bringing down the level of your blood sugar to the normal. Now, the normal range of our blood sugar levels should be within 60 to 100 or around 108. That is what we call the normal range. Anytime our blood sugar levels begin to get above that, especially when we have not eaten, then it becomes worrisome. And then according to studies, any blood sugar level greater than 126 milligrams per DL is classified as diabetes. So there are various symptoms that you may see in someone that has diabetes. They may begin to urinate a lot. They can wake up at night or even during the day urinating a lot because of the fact that their blood sugar levels are high. A lot of them may become so thirsty, drinking a lot of water. A lot of them may begin to lose weight. Weight loss is a major symptom in diabetes, and some of them may even present with wounds that are not healing. Poor wound healing is also a major symptom of diabetes. Some men might present for the first time with issues of erectile dysfunction. That may be the first pointer to diabetes. Now, there are two major types of diabetes, the one we call type 1 and the one we call type 2 diabetes. Type 1 diabetes is usually due to a genetic problem, making it impossible for the body to produce enough insulin. Remember what insulin does? It helps to lower the blood sugar following a meal. So if the body cannot make enough, it means that after eating, then the blood sugar level will be high in the system. Another type of diabetes is what we call type 2 diabetes. Type 2 diabetes is due to the fact that the insulin being produced is not working. We call it insulin resistance or insulin insensitivity. So imagine when the body is producing this insulin and is not doing its work, the blood sugar will be high again. Now, these are the two major types of diabetes. And then according to epidemiological figures, it has been shown that the number of people who are having diabetes is increasing by the day. As of 2011, it was shown that about 366 million people globally they are suffering from diabetes. Now, it was projected that by the year 2030, about 550 million people will suffer diabetes. And we have been able to recognize that the major driver of this increase in the prevalence of diabetes is type 2 diabetes. Now, when you look at type 2 diabetes, statistics show that over 95% of people with diabetes have the type 2 subtype. This shows that the type 2 diabetes is the major driver of the global epidemic of diabetes. So for this reason, we will focus more on type 2 diabetes. Type 2 diabetes is a lifestyle disease. It's as a result of feeding the body wrongly for a so long period of time that the body's metabolism becomes deranged. Now, a lot of people with type 2 diabetes definitely will pass through what we call the metabolic syndrome, a situation whereby the body's biochemical pathways have been disorganized. Let me tell you about the common food we eat in our environment. There's something we call glycemic index. The glycemic index is a measure of how fast the food you take will increase your sugar level. There is something the body wants. The body wants a kind of food that you eat, and it gradually elevates the blood sugar so that the pancreas can respond and bring it down gradually as well. But majority of the foods that we have in our environment today are such foods that when you eat them, they will spike your blood sugar. Spiking Spiking your blood sugar means giving the pancreas a lot of work to do. So as they spike the blood sugar, the pancreas is releasing a lot of insulin, and that can lead to overstressing and burning out of the pancreas. What we have realized is that when the body is fed wrongly with the common type of foods we have around us, like rice, eba, yam, the carbonated drinks like the pasta, bread, and all these foods that are found around us, easy to make foods, they tend to increase the body sugar level very fast. Now, there's something we call baseline glycemic level or baseline glycemic index. It is 55. But the common foods we eat, like the rice and the rice I just mentioned, their glycemic indexes are around the ranges of 80, 70 something. So this puts a lot of pressure on the pancreas. And if this is sustained over a long period of time, the pancreas definitely will suffer. The pancreas will begin to malfunction. And that is the major pathogenic pathway for type 2 diabetes. In Faforlife, what we try to do is to inform our community and people all over the world with the right set of health knowledge as to how to prevent this global menace called diabetes. And for those who have already developed diabetes, we want to empower them with knowledge as to how to reduce or mitigate the complications. And for those who already have complications already, how they can, come out of those complications and live a healthy life again. We have quite a number of recommendations for this global menace called diabetes. First of all, I recommend routine blood sugar checks. It's very, very key. Whether you are diabetic or not, please, routine blood sugar checks is very, very important, because we have seen people presenting for the first time in the clinic with complications of diabetes. That is not wonderful. And I've made it known here that fasting blood sugar levels less than 108 milligrams per DL is the recommended levels. So if your fasting blood sugar levels are above 108 milligrams per DL, is either you are in pre-diabetes or you are already a diabetic. There's something we call pre-diabetes. I also want to talk about exercise. Exercise is very, very important. It's important that you are physically active. Physical activity is necessary. These days, people do a lot of sedentary work. They sit down from morning to night. They enter their cars, drive home. They are not involved in physical activity. They begin to add excessive weights, and these things contribute and lead to increased insulin resistance and the possibility of type 2 diabetes. I also recommend lifestyle and dietary modifications. Remember, type 2 diabetes is a lifestyle disease. So I recommend for people to eat well. Remember, let thy food be thy medicine. Feed yourself rightly. So in terms of diet control, I talk about quality and quantity. Very key. Now, in terms of quality, we recommend foods that have low glycemic indices. If in our environment, food like the beans, the green beans, the normal beans, the kidney beans, they have low glycemic indices. These foods are wonderful. Food like unripe plantain is good. The nuts, cashew nuts, groundnuts, they have low glycemic indices. Foods like these, lentils, there are many of them out there that you should eat. It helps a lot to control your sugar levels because their glycemic indices are usually less than 55. I'm not saying that we cannot eat rice, but the quantity matters. And eating rice, for instance, with a lot of fiber, vegetables is very, very important, because there's something vegetable does. Vegetables helps to reduce the rate of absorption of sugar into the bloodstream following digestion. Let's talk about quantity. In quantity, I usually recommend what I call aliquots. Aliquot means eating in small portions. What will this do to you? When you eat in small portion, the quantity of sugar getting into the bloodstream per unit time will reduce. Imagine when you eat a full bucket of rice and the glycemic index of rice is around 80. That's white rice. Imagine eating that and eating a large quantity. So you will increase both your glycemic index and your glycemic load at the same time. So these things are not recommended. I say whether you are diabetic or not diabetic, practice these things. I also recommend using the right health products. Remember, natural products are rich in antioxidants, vitamins, minerals, and what we call bioactive substances that can help our bodies regulate blood sugar levels, that can also protect the cells of our bodies against reactive oxygen species, or what we call free radicals. So using natural health products is very, very important. For instance, in Faforlife, we have amazing products like Salud Extra, very amazing. We have Spiders 15, very amazing. They are enriched with natural ingredients that can support and maintain optimal blood sugar levels, like what we call the fenugreek, the juniper berries, the cinnamons. They are all embedded in these wonderful products. We also have the one we call Faforon. Faforon has helped a lot of people maintain normal blood sugar levels. But remember, Above all, lifestyle and diet modification are the foundation of maintaining normal blood sugar levels. They are also the foundation of handling and reversing type 2 diabetes. Now, in closing, I want to state here that it is disheartening that people use their hard-earned monies to go to market to buy type 2 diabetes. I think the world needs to be wiser. People need to gain wisdom. Let's eat appropriately. Let's practice healthy living. Let's practice healthy behaviors. Let's eat well. Let's sleep well. Let's exercise more. Let us be more active. Let us have and develop that consciousness of staying healthy at all times. That is the panacea to solving this menace of global epidemic called diabetes mellitus. Thank you so very much.